after Charlie died and I realized that Swedish Covenant Hospital was going to become a Plaintree Hospital, I really wanted to do something concrete. When I come and I hear the music, first of all, I get very teary. You know, it brings back memories of my husband. And so that's very sad, but it's also very joyful because through his and my experiences here, we've shared Plaintree with this hospital.
The environment, the educational resources, the arts and entertainment program, all make it so much more pleasant to care for patients at our hospital. And those are parameters that Plaintree has introduced here.
Part of the Plaintree culture believes in healing not only the body, but the mind and the spirit. And complementary medicine is a great way to complement that, and offering such services as aromatherapy, acupuncture, massage therapy.
What about pet therapy? Some of our hospitals even have a patient's own pets program where the patient's own animals can come to visit.
Animal-assisted therapy or pet therapy is designed to be an additional intervention as part of the rehab process. So what we are looking at is using the dogs as a mode to meeting a patient's individual goals so that we can provide another way of achieving what the patients are working on in their rehab program.
I got very good care here. Nurses, therapists were great, physical therapists. But the dogs brought out something special, something to look forward to and have fun with.
We're all part of a group called the Shenny Troop. It was founded 15 years ago here in Chicago by a woman who had grown up with a mother who was in a wheelchair and had understood from a very early age the power of having a dog and what that meant to her mother's therapy.
It's the best. I absolutely love the dogs. They are so unconditional. They come in here and they are ready to work and they listen and they're so motivating and really very therapeutic.
It's rewarding to watch the people's faces when you come in there with a dog. I'm kind of like the chauffeur for the dog. The dog is the main attraction, and that gets to be kind of funny at times. It's rewarding because you can see the stress levels go down in the patients, and big benefit is I notice the staff at the hospitals or clinics or hospice homes, wherever I go, that you can see the relief in their faces also.
It's amazing what an animal can do. It's just nice when you see somebody in bed and they may be cooked to tubes and things, and you bring a dog in and they forget why they're there for that moment. You know, the dog seems to bring out the best in the people.
I think it's good for the patients to have somebody come in, cats, dogs. Yeah, where do you want to go? Oh, you come over there. Huh?
I started the program because my own greyhound was certified and we were working in nursing homes, and I felt that Plaintree was just a perfect place to start a program. It belongs here. It belongs in Plaintree.
We really look for the ones that have a history with animals, so it really brings in a lot of motivation and brings back a lot of really terrific memories and really sets our patients up for success, which is a big part of what Plaintree is all about.
The last of our components is healthy communities. How do we bring the community in through volunteers and bringing in schools and getting kids involved in healthcare early on? And how do we go out into the community so that it really is healthcare without barriers, healthcare without walls?
Our music program was actually started by high school student volunteers.
I love playing music as it is, but to be playing music for somebody else and to be helping someone else, it's a great feeling.
Oh, I think she's very sweet, and I think she's very good, and she plays very nicely.
It's definitely a therapy for me. You can't beat it. It keeps me going because if it wasn't for that, I would be sitting in a chair, watching the boob tube all day, wasting my life. All I do most of the time is play the guitar, and I enjoy it very much. And I know other people do, so it makes us both happy.
Another neat thing that I saw in Griffin Hospital that we've replicated at hospitals here in the Aurora system has been baking bread, doing a bread machine on the floor and just letting that aroma of the fresh baked bread float down the hallways.
I was around when they first started it. Jackie asked me if I wanted to make cookies, and I said, sure, I can make cookies. And she says, we'll make them on the floor so that we have the aroma, which is wonderful. It evolved to breads, bread and butter, different breads. And I like to make people feel good because I think we pass that on to others.
We do focus group work and we listen to patients. We ask them to describe for us, what do you feel would be the ideal healing hospital experience?
I think that the biggest difference of all is that in this hospital, you're not a number. Mm-hmm. You're treated with a very personalized way.
I found the most comforting thing about being here, it was the people, the staff, the doctors, the nurses, the entire medical staff treated me as an individual. I was not a number, I was not a case, I was me, a person.
When patients leave here, they come up to me and say, there was something different about this place I've never experienced in a hospital before. What was it? And I will tell them that was a Planetree experience.
What Planetree said is, we know you're trying to be a good nurse. How can we make it easier to be the kind of caregiver you're trying to be? And it just was so powerful for me, and it's why I'm still a nurse 21 years later. And I really owe that to Planetree.
The Planetree retreats are really exciting. We give heated neck rolls and bake cookies and create the ambiance that we should be trying to create for our patients.
We can see improvement in our patient satisfaction scores. And I guess in answer to that question, typically one would say there are certain metrics, whether it's in employee turnover, whether it's in patient satisfaction. But how I measure it is in the faces of the employees and the things that they tell me of what they're doing and their successes. And that's how I truly measure it.
And that's what we find is Planetree doesn't have to cost more money. How much time does it take to call someone by their name? How much time does it take to smile?
In addition to the hospital becoming the hospital of choice for consumers in its market, which ultimately results in improved financial performance, there's a movement nationally for commercial health plans or governmental payers to reward hospitals for better performance.
I'm amazed at what the Planetree organization has done and continues to do. And I'm hoping, and I think it's happening, that it's just going to keep growing.
So Planetree has really influenced some very important things about the patient experience, and I think we're going to continue to do that.